Hi, my name is Sam, and this is Andrew. We are two final year medical students from Oxford and Cambridge, and we've been working with a really amazing team over the last few days. We'd like to thank them so much for their brilliant work, and we're really excited to share with you what we've been working on. It's called Predict, and it's a novel healthcare technology we're really excited to talk about. So the problem is quite straightforward. We all know that A&E admissions and the general urgent treatment care centre system is under increasing strain with a more complex cohort of patients. We also know that while people get ill at a reasonably constant rate during the week, people seek care at slightly random and maybe unpredictable times of the week. And we also know that doctors and nurses' staffing patterns are reasonably flat across the 24/7 period. So we've developed this novel system called Predict. It's a machine learning system that's able to try and predict how many people come to A&E the next day. And so this is a kind of a novel healthcare resource for healthcare planners. The idea is that some sort of planner at 3 p.m. on the day before a particular day will be able to look up an idea of how many people will be expected to be coming through the system the next day. They'll be able to use this data to liaise with multidisciplinary team, to engage with nursing and doctor staffing plans, to improve the patient's journey, to also save money by more careful allocation of staffing resources, and also to protect frontline staff from the real excesses of patient demand. And I'd like to pass it to Andrew to talk about exactly what was involved in making the model.
Thanks, Sam. So our aim was to build a model which, at 3 o'clock the day before, can allow people running the emergency department to predict what is coming their way the next day. And that's why we've used a lot of open data collected from NHS England, who release accident and emergency attendance data for winters on a day-by-day basis, on a trust-by-trust basis. We've pulled in weather data from historical weather data. We've pulled in some NHS 111 data, including the number of calls they've had, the number of ambulances discharged. We pulled in some demographic data, including the size of the population in addition to the percentage of the population over 65. And we've pulled in some bank holiday data. And we're looking to incorporate extra stuff, including, but in no way is limited to, infectious diseases data, prescribing data. It's all there, it's all open, and we're hoping to integrate it. Anyway, our solution is using deep learning and artificial intelligence to build a model, a neural network, which we're calling Predict. And it's Predict that let us do this. We took Predict, we fed it weather from 2017, and we decided, based on the forecast the day before, we tried to predict what would come in the direction of A&E. And let's show you how it performed against the actual data. So, just exit this. And, apologies, I hope this isn't counting towards our time, it's just fine. So, brilliant, okay. If you just give me 1 second. Cool. Okay, so the orange line, which is appearing red on this projector, represents what our model thought would happen for this particular trust, Gateshead. The orange line is what we thought would happen, the blue line is what actually happened. And as you can see, it tracks it quite well. So to give you another example, I'd like to pull up my home hospital, Cambridge's Addenbrooke's Hospital. This is our trust. And once again, you can see that our predictions, the orange line, tracks the pattern quite well. So to give you another example, my sister is a junior doctor in the West Midlands at Burton Hospital, Burton-upon-Trent. And once again, you can see that our model is quite accurately predicting the shape of the curve. So you're able to decide, are we going to have a busy day tomorrow, are we going to have a quiet day? You can then arrange locum cover, you can arrange additional ED practitioners, or even tell the ambulance service to take patients elsewhere if you see this coming.
15 minutes.
Okay, thank you. So we'd like to open the floor to any questions and say once again a very big thank you to our brilliant team who have contributed immensely. Yes?
Does this mean less predictability for A&E staff about when they're going to be working?
If anything, it means a little more predictability. So fundamentally, human behaviour is quite predictable. What we found are lots of patterns, including what we call the Monday effect, the Friday effect, the Christmas Day effect. And if that is factored into staff planning on a year-by-year basis, in fact, it means more predictability. And if the model is used correctly, you're reducing the need for urgent staff, or for locum and temporary staff. Yes?
Well, so, I mean, clearly when you've done this, you haven't done it at 3 o'clock the day before. You put in, I'm assuming your method is like 5 years worth of back data, and then you ran it to predict what would happen in 2017, and then compared that data set.
Yes, so the data we have used to predict this is the data which would have been available to A&E at 3 p.m. the day before. So the weather data we're predicting on is the forecast data, which you could have accessed at 3 p.m. We're predicting on only data that would have been available to clinicians the day before.
Okay, so what was your... Okay, so essentially the reason why you've got this 3 o'clock the day before limit is because of the weather.
Well, it's
That's
because
just an idea of the kind of time when it would be a sensible time for the healthcare planners to sit down and think, how can we plan for tomorrow? It can't be like 9 p.m.
it's easier to arrange a locum at 3 the day before than 8 that morning. But
Well, no, it was more like, can't you do it the week before?
oh yes,
That'd be the
absolutely.
next step.
Because that would be the goal, right? And yeah, I was wondering what population you used to test this. What was your...
So the data that is available to us covers the winters of 14-15, 15-16, and we tested it on 16-17. So it's a relatively narrow data set, but the patterns still come out quite good.
Yeah.
And we'd hope, of course, that as we take it forward, we would speak to the relevant agencies, get more data to make our model even more powerful.
This is only winter data, so it's called situational reports every day in winter. They release data about how many people came to each A&E.
So-
That's what we have.
Yes.
Can you sell us the Ryanair concept?
I know Michael O'Leary's in the business for a new scheduling software, so we'll have a chat.
Hi. So not claiming this is my position, but could you address a very pessimistic, disbelieving person who saw wriggly lines on top of other wriggly lines on a graph? So I've had particular problems with open data in projects I've done before, or should we say open data, and quality, including layout and basically manually constructed spreadsheets that are arranged randomly. I'd love to hear about overcoming those problems, because that's something that I think is really transferable.
Fine, so the way we have solved this is using MySQL, which is a relational database system. Sam and I spent much of the night up getting data to be compatible, and really the trick to it is using unique identifiers. So you set every single fundamental property against a unique identifier, and then your tables contain nothing but unique identifier against what it represents.
But how do you get the data from the real world data into this? Because you can have the best database in the world if you fill it with like Java.
Right, we've written our own script.
That's another part of the question. So the data that's available is a situational report, but they're formatted very poorly, and I think a lot of the points you raised are really, really true. And also we had, for example, dates formatted in unpredictable ways.
Yeah.
Had to write 100 lines of code just to reformat dates in a
You
particular
have
way.
actually just done this by brute force.
Yeah.
So we
Wow.
So a lot of scripts are required to process the dates and also separate out weekends
Yeah.
and all that kind of
So
stuff.
out of the day time we had, we probably spent 7 hours just doing data prep,
Yeah.
2.5 hours generating what you see on the screen. But that's not atypical of a data project.
We hear you. Thank you.
I think we should stop on wow. I think that's a good way to finish.
Yeah.
Thank you very much.